Today, we will be talking about bowel cancer. But first, what is cancer? Cancer occurs when abnormal cells multiply and create abnormal cell masses, known as tumours, in solid cancers such as bowel cancer. So what is bowel cancer? Bowel cancer occurs in any part of the large bowel. Small growths, known as polyps, arise in the inner linings of the bowel and are benign. However, if these growths go undetected and undiagnosed, they can become malignant and penetrate into deeper levels of the bowel wall and metastasize. During this in-service, we will provide you with an understanding of the pathophysiology, disease management, and holistic care that an individual might go through whilst dealing with bowel cancer.
Signs and symptoms. A sign is defined as an objective evidence. It is a phenomenon that can be detected by someone other than the individual. It is a fact that something exists, is happening, or may occur in the future. They can be seen or felt by the patient, physician, and others, which can therefore identify their fundamental cause. The earliest phases of bowel cancer begins in the inner lining of the bowel. It starts within the normal mucosa with a generalized disorder of cell replication that results in growths called polyps. Bowel cancer is unique in the sense that signs and symptoms begin asymptomatically and don't show until the disease has progressed. A lot of patients who experience bowel cancer often have blood in stool and bleeding after a bowel motion, palpable mass in the abdomen, and changes in bowel habits such as constipation and loose motions. Over time, the cancer tumor will grow and surpass the membrane wall in the digestive tract. That can result in bleeding because it has grown into nearby blood vessels. This can also be caused by ulceration. Cancer is deadly and continues to multiply, grow, and invade other nearby organs and tissues. This tumor can cause blood visible in stool due to the fact that most things within our digestive tract gets digested and released through the rectum. It causes dark blood with stools. Depending on where the bleeding is coming from, the blood may also be bright red. A symptom is defined as a change in your body or mind. It is identified as a subjective matter and is only felt by the individual. A withdrawal from usual function where the individual is able to identify a change in function or feeling. However, symptoms usually come interchangeably with signs. Depending on where the development is, clinical manifestations may appear differently for some. However, some common symptoms experienced include anemia, weight loss, unexplained tiredness, weakness, fatigue, and loss of appetite. Sudden and unintentional weight loss occurs in a number of different ways. The immune system uses energy, ATP, to work against the cancer, fighting the disease. Cancer cells differ from normal healthy cancers in many ways. They derive most of their energy from glycolysis that results in using most of the body's ATP. Tumor cells alter their metabolism to maintain continuous survival that is reliant on the constant supply of nutrients and energy within the body. This results in tiredness and fatigue because the body has little to no energy due to its constant depletion from the cancer cells. Anemia occurs when there is a decrease in the amount of healthy red blood cells to carry adequate oxygen to body tissues. It also impairs the body's ability for gas exchange. Tumors can cause ulceration in the digestive tract that can result in bleeding. As a result, the body's healthy red blood cells are being depleted. Due to this, anemia can also play in conjunction with other symptoms such as unexplained tiredness, weakness, or fatigue. This is a result of an inadequate amount of red blood cells to transport enough ATP, oxygen, and nutrients around the body that it needs to function.
And care. Prevention of bowel cancer. Not smoking, having a healthy diet with plenty of fiber from fruits and vegetables, having a limited amount of red meat and alcohol, and maintaining a healthy body weight. Nursing assessment and care. What are some common signs and symptoms a patient may present with? A change in bowel habits, blood in stool, abdominal pain or bloating, weight loss, fatigue and unexplained anemia. Spreading awareness. Talking more openly about the signs and symptoms of bowel cancer, making people more confident to talk to a health professional about any concerns they may have in relation to bowel cancer, and getting people over 50 to complete the at-home screening test. Nursing assessment and care. Collecting both subjective and objective information from the patient, finding out what their health literacy level is, and does the patient and their family understand what the cancer diagnosis means in terms of treatment? Patient education. Part of the nursing care for this type of cancer is to educate and be there for the patient when they have any questions, talking through what will happen now as they have now been diagnosed, educating the patient on what will happen with their surgery and if there will be any further treatment such as chemotherapy. Holistic care. Having a multidisciplinary team involved in the patient's care so there is support in all aspects of their life. Members of the team include nurses, doctors, psychologists, social workers, nutritionists, physiotherapists, and many other health professionals to make sure the patient receives help and support in all aspects of their life, which makes for well-rounded care.
Diagnostics is the process in which bowel cancer is detected. There are several procedures used to diagnose. However, today I will be talking about colonoscopies and biopsies, as they are the most definitive procedures in diagnosing, along with the screening tool of fecal occult blood test, which is essential in starting the diagnostic process, particularly in asymptomatic individuals. Immunochemical fecal occult blood test is a national bowel screening program. Although it does not provide a direct diagnosis of bowel cancer, it can detect micro amounts of blood in the feces through pathology testing in laboratories. Here's a national ad that highlights its importance.
So you've turned 50 and you have early stage bowel cancer. You just don't know it. Bowel cancer takes more lives than breast, prostate, or skin cancer. So everybody aged 50 to 74 gets a free test kit every 2 years. Put it in here, and your cancer will keep growing and growing. But if found early, there's a 90% chance of successful treatment. So please, don't throw away the chance to save your life.
If the individual receives a positive result, they converse with the doctor, who will then refer them on to more diagnostic testing, such as a colonoscopy. Colonoscopies have the greatest single test accuracy and adaptability in detecting and diagnosing both symptomatic and asymptomatic individuals. It is considered the gold standard and the final test in the investigation, as they thoroughly assess the large bowel. If any abnormalities are detected, such as polyps, they are biopsied in order to ensure a correct diagnosis is made. Colonoscopies have the highest prevention rate, as highlighted in the meta-analysis, where the detection rate of bowel cancer was 97.4%. Biopsy is another diagnostic procedure when a small amount of suspicious tissue or polyps are removed in order to test if they are cancerous. Distinguishing polyps is more accurately done through colonoscopies and surgeries. Pathologists are able to examine these tissue samples for any signs that may indicate disease, or if there are any specific genetic changes that may be an indication for cancer. The healthcare journey can be determined by the stage they are at when they are diagnosed. Early detection is vital in diagnosis, as it can attempt to stop the progression of bowel cancer. However, if gone undiagnosed, it can significantly affect an individual's health outcomes and overall well-being. As one's survival rate decreases along with their quality of life due to the immense physical and psychological stress it induces, both on the individual and the caregiver. Therefore, it is essential that these tools work effectively in combination with each other in order to start the process of detecting abnormalities, searching for them, and testing them in order to come to an accurate diagnosis.
Chemotherapy drugs are one of the most effective forms of medication used to treat bowel cancer. Chemotherapy targets malignant cancer cells in primary or metastatic tumour sites and tries to eliminate or reduce the number of these cells. Most chemotherapy agents are most effective during the dividing stage of a cell cycle, therefore struggling to kill off cells during the resting phase known as DO. 3 common chemotherapy drugs used for the treatment of bowel cancer include Folfox, irinotecan, and capecitabine. I'll be focusing on capecitabine. Capecitabine belongs to the anti-metabolite class of chemotherapy and is an anti-neoplastic agent. It works by stopping cells' ability to form and repair DNA, therefore stopping cancer cells from forming and multiplying. This medication comes in tablet form with the daily dose of 2 tablets a day. Some common side effects of capecitabine include loss of appetite, this is often due to feelings of nausea and fatigue, diarrhea, mouth ulcers and sores, abdominal pain, and soreness and redness of palms and soles of feet. Some contradictions of this medication include pregnancy, breastfeeding, and fertility, along with lactose intolerance due to the drug containing milk sugar. A common symptom of bowel cancer is constipation, affecting 39 to 86% of patients. Coloxyl senna is an effective stool softener combined with a laxative that helps to prevent and treat constipation. The two active ingredients are docusate sodium and senna, with the docusate sodium working to draw water back into the stool, making it softer, and the senna working to stimulate the bowel. By drawing water into the stool softens and therefore makes it easier to pass, along with senna, which stimulates the bowel to contract, which accelerates the passing of stool. The recommended dose is 1 to 2 tablets a day, and some common side effects include abdominal discomfort and flatulence. Coloxyl senna is contradicted in patients with Crohn's disease, appendicitis, or bowel obstructions. Two important factors of chemotherapy are cytotoxicity and immunosuppression. Cytotoxic drugs can cause serious health effects, and therefore only those who require cytotoxic drugs should be exposed to them. Personal protective wear should be worn when handling cytotoxic medication, waste, or whenever there is a risk of fluid exposure. Patients need to be educated on cytotoxicity along with immunosuppression and the increased risks of infection involved in this.
It is important that we research and analyze epidemiological studies to identify the rate of distribution, occurrence, and potential risk factors behind a specific disease. In 2017, bowel cancer was labeled as the sixth leading cause of death, accounting for 5,325 deaths. It was found to be the second leading cause of cancer death in Australia. In addition to this, research shows that diagnosis, number of deaths, and survival rate of colorectal cancer is steadily increasing, where the introduction of the National Bowel Cancer Screening Program greatly contributed. It is also evident diagnosis increases with aging. Additionally, there is a wide gap between men and women in regards to aspects of bowel cancer. Evidence suggests that overall males always had an increase in number of deaths, number of cases diagnosed, and incidence rate compared to females. In Aboriginals and Torres Strait Islander people, the incidence of large bowel cancer ranks third common. Based on data, it is evident that Aboriginal and Torres Strait Islanders, as well as low socioeconomic areas, have a higher mortality rate and incidence rate of bowel cancer. Worldwide, colorectal cancer is the third most common cancer in the world for men, and for women, it is the second most common. As well as this, it is found that in cancer death, it ranks as the fourth cause of cancer death globally. In 2012, it was recorded that there were 693,009 deaths worldwide. Bowel cancer does not have a specific cause, rather it has risk factors to promote its development. Examples of environmental risk factors are smoking, alcohol consumption, and obesity. Some non-modifiable risk factors comprise of a personal history of adenomatous polyps considered as precancerous, bowel disease, and family history of bowel cancer. It is clearly evident in data that people living in lower socioeconomic and remote areas have more cases of positive screening as a result of resources and location. People with a low socioeconomic status may have a different prognosis compared to people in urban areas because of treatment availability. Prognosis may also differ depending on the risk factors of bowel cancer. Additionally, age can affect a patient's prognosis. Bowel cancer has a high survival rate if found and treated at an early stage. If left untreated, the cancer metastasizes and spreads to other organs. Evidence shows that early screening and management of one's health is important to diagnosis of bowel cancer.